Hey, this is Dr. Ty from Premier Orthodontics, and in this video we're going to be answering your questions you post in the comments section. So, as a reminder, if you haven't yet, make sure to subscribe to the channel, tap the notification bell, and like the video if you find it helpful. So let's go ahead and get started. Alright, so this question comes from Farah. If my permanent retainer become bend at the end and the bend point is breaking, and my bite is on the permanent retainer, the dentist can't bend it back to the old position without breaking it, can the dentist take it off and put a new one back? Or do they have to use and fix the old one? So, alright, so based on the question here, it sounds like you have a permanent retainer that's broken on one end and it's bent and you're starting to bite on it. So, most of the time, when this happens, it's better to just replace the entire retainer. So depending on the type of wire, usually over time they start to get fatigued and that wire can kind of bend over and over and eventually it'll just break. So even if the wire is still there on your permanent retainer, if it's already kind of getting damaged at this point, it's usually best just to take it off, replace it all, and start fresh. That's usually not a big deal. It takes like 10 or 15 minutes to get that done. So definitely ask your dentist. Depending on if the wire still looks good, it's in good shape, they may be able to just remove the adhesive on that one tooth, put it back into position and glue it back on. But most of the time, if the retainer's been on there for any amount of time and that wire is starting to get a little damaged, it's better off just to replace it, start over, and get a fresh retainer. And hopefully that'll last you for a longer period of time. All right, this question, I just got my retainer, so is it normal for it to hurt? So generally your teeth shouldn't really feel painful when you get retainers, unless it's been a period you got your braces off and you had to wait a couple days and then you got your retainers in. What can happen during that period is your teeth may shift just a little bit. And so when you put the retainer in, it's starting to shift your teeth back to where they were the day the braces came off. So what you can do is just wear that retainer really well for a couple days, and generally the teeth will kind of settle into that retainer and you shouldn't feel any more discomfort. Sometimes patients might feel a little bit of discomfort on their gums if the retainer is impinging or pressing on the gum tissue. So if you feel like it's really pinching your gums, you can usually go see your orthodontist. They can trim the retainer and try to make it more comfortable. But if it is just the teeth feel a little bit sore when you wear it, usually that means you just need to wear it really well for a couple days, and that should go away. All right, this question comes from Jerome. Clearly, my ortho doesn't want to fix my moderate crossbite with Invisalign. He said, I'm happy with how your teeth look, but I'm not even happy with it. I tried talking to him about it, but he continues to repeat himself. How should I tell him that I'm unhappy until the result due to still having a crossbite? It bothers me so much. He often tells me that I needed a surgery, but he doesn't tell me it's best not to get a surgery done. But he also has other options. He says there will be complications near future. Based on this question, it sounds like you have a crossbite and you're being treated with Invisalign, and the crossbite hasn't been fully corrected. So depending on if you're an adult, sometimes crossbites can be really difficult to correct entirely. Crossbites are usually best fixed in the teenage or preteen years. Generally, that is the best time to fix a crossbite. So in adults, crossbite correction can be somewhat unpredictable, but if it is something that really bothers you, it may be able to be treated, but sometimes surgery might be the best option. So again, if it really bothers you and if your doctor doesn't feel like it's in your best interest or he doesn't recommend it, you can get a second opinion from another orthodontist and see what they recommend and see if there is a way to get that fixed. At least get all your options explored, find out the pros and cons of each one. So again, crossbites, we like to fix them. Sometimes in adults especially, it is very difficult and nearly impossible to fix with just Invisalign alone. A lot of times that is something that needs to be fixed with surgery just because as adults, the upper jaw is fused and we can't expand the bones in an adult without surgery. And that's generally how you would do it in a teen or preteen. Before there's bones fused, we can expand. So hopefully that helps. Again, ask your doctor for more information. Feel free to get a second opinion if you feel like it is something you really want to pursue, and hopefully that helps. So first I want to say amazing video. Thank you so much. You have helped me so much, but I do have a question. I am 2 months into my braces journey, and I do have a moderate overbite. How far into treatment do patients like me usually get rubber bands? Usually the first wire that you're in when you get braces is really, really light. So if you have quite a bit of crowding, we might use a really light wire. Sometimes the rubber bands might be too strong for that light wire. So the rubber bands will actually overpower the wire and you'll get some side effects that may not be desirable. So most of the time we in our office will wait, 3 or 4 months, maybe even 6 months before we start rubber bands. There are times we might start on that very first appointment, but it really depends case by case. So if you have a moderate overbite, I would, guess that in the next couple visits to your orthodontist, they'll have you start rubber bands. But definitely ask them. They'll be able to give you a timeline more specific to your case, but usually within the 3rd or 4th visit, most patients can get started. They're usually in a little bit thicker wire at that point, and the rubber bands can be used without getting those side effects. All right, this question comes from Cat Moon. These are all for overjet overbites, but what about the opposite kind of overbite, like I have, where the top teeth were slanting too far back into the mouth? I haven't seen how that is fixed yet. So it sounds like you're describing an underbite. So that is where the top teeth sit behind the bottom teeth. So if these are your teeth, if your top teeth are behind these ones, that is an underbite. So we actually do have a video that describes how we fix underbites with braces. We'll link to that in the link above. And so check that out. So there are lots of different ways we fix underbites. Those include anything from extraction, surgery, rubber bands, different appliances. So check out that video and we'll go into more details and hopefully that helps. All right, so that's it for this video. So hopefully you found it helpful. If you did, give the video a like, subscribe to the channel for more braces related content, tap the notification bell to get notified when we make new videos. And if you have questions, make sure to ask them in the comment section below and we may answer them in a future video. Thank you so much for watching and we'll talk to you soon.